Hi everyone, my name is Amer Zeidan, an associate professor of medicine at Yale University and interim chief of Hematologic Malignancy Division in Yale Cancer Center. It's a pleasure to be with you today. I'm gonna talk about some of our work that's being presented in ASH 2023, focusing on some of the translational aspects of the COMMANDS trial. So the COMMANDS trial was a randomized phase 3 trial that looked at comparing luspatercept, which is a protein, it's a fusion protein that is made of a part of an immunoglobulin attached to a receptor for activin or a modified extracellular part of a receptor activin 2B, with the idea that this will be a ligand trap. It will remove the transforming growth factor superfamily ligands from the circulation. Those ligands have been shown to, in patients with lower risk MDS, to suppress erythropoiesis and lead to inflammation and lead to anemia in patients with MDS. So by removing these ligands, there is reactivation of erythropoiesis, which has translated in the MEDALIST trial, which was after ESA failure, to improvement in transfusion independence for anemic patients with ring sideroblast. So the COMMANDS trial looked at the frontline indication of luspatercept compared to ESA as a frontline treatment for anemic patients who are transfusion dependent with lower risk MDS, regardless of whether they had ring sideroblast or not. And the trial was positive. This was presented ASCO and EHA 2023 and published in the Lancet Journal, where the transfusion dependence rate with luspatercept was double that with ESA, 60% compared to 30%. And the durability was much better, 2.5 years compared to 1.5 years with ESA. So what we are presenting in ASH 2023 is an update focusing on the translational work in which analyses were conducted on the samples that were obtained from this trial, both from the blood as well as the bone marrow throughout the treatment. And there were several messages that are important to highlight. I think the first message is initially the thinking that luspatercept works mostly on late-stage erythropoiesis, while ESA work mostly on early erythropoiesis. But what the work is actually on those samples show that luspatercept works on relieving the maturation defect not only at late erythropoiesis, but also on moderate and initial phases of erythropoiesis. And therefore, because of resolution of this maturation defect, it leads to recruitment and sustained increase in erythroid precursors that is early and sustained. So I think that's very important. Also, the work has shown that there is a reduction in inflammation. Inflammation is a big component of what happens in patients with lower risk MDS. So luspatercept has been shown to reduce the inflammation that happens in the bone marrow in those patients. And importantly, it also modulates the transforming growth factor pathway expressed genes. Again, that probably what mediates the reduction in inflammation that is seen, and this has been correlated with clinical benefit. And lastly, luspatercept has been also correlated with improvement in the iron hemostasis, in particular through reduction of hepcidin. And I think this is also important in terms of the cardiac impact of the drug. So luspatercept has been associated with reduction in the proBNP, which is a biomarker for heart failure. ProBNP comes from the cardiac myocytes, and it usually goes up in patients who have hypoxia or they have stretching of the cardiac muscles, or if there's, for example, heart failure. So luspatercept actually has been shown in this trial to lead to reduction in proBNP, which probably will correlate with reduction in cardiovascular events, although this again needs to kind of be demonstrated prospectively. But I think our translational data kind of suggest mechanisms through which the clinical benefits that are seen with luspatercept are mediated. So I invite you to join us for the presentation of the ASH work, and please feel free to reach out to me for any questions. Thank you so much.